Good morning, everybody, or good afternoon for those that are joining us from the other sides of the ocean. My name is Natalia Winder. I am the Associate Director of Social Policy at UNICEF. Unfortunately, because of some technical difficulties, Ms. Karen Brown, the World Bank Global Director for Gender, who was supposed to chair our meeting, will not be able to do it, so I'll take over for her in terms of sharing, but she's listening to us, and I'll be trying to reflect some of her remarks at the start of this webinar. So welcome everybody. Very happy to be here, to be able to join this very interesting discussion on GBV and social protection in the context of COVID-19. This is the 31st webinar of the Social Protection Responses to COVID-19 webinar series. This is a series which is a joint effort initiated by IPCIG, GIZ, on behalf of the German Federal Ministry for Economic Cooperation and Development, BMS, and the Australian government's Department of Foreign Affairs and Trade, in collaboration with the socialprotection.org platform and in cooperation with many partners working on social protection across different organizations. The webinar series is part of an initiative with two major components. One, a collaborative mapping of countries' news and documents disseminated weekly through a dedicated newsletter, which we hope you are all part of, and an online community on the topic to really help us to systematize information and foster a discussion. Please, I urge you to join the online community, Social Protection Responses to COVID-19, to learn more about the whole initiative and find out how to collaborate and learn about what's going on across regions. This particular webinar is organized also by the SPIAC-B, the Social Protection Interagency Board Gender Working Group, consisting of representatives from several agencies, including UNICEF, DFID, FAO, IPCIG, the UNICEF Innocente Center, UN Women, among many others. I would like to also mention that this will be the second to last webinar of the series. This initiative has been one of socialprotection.org's key achievements so far, bringing together social protection practitioners, but also practitioners from other sectors across the world to discuss solutions and innovative approaches for the challenges brought up by the pandemic. To bring the series to an end with a flourish, socialprotection.org will host a global e-conference, turning the COVID-19 crisis into an opportunity. What's next for social protection? And this will take place on the 5th, 6th, and 8th of October of this year. So looking forward for you to join that particular event also. This event will provide a space for evaluation, sharing experiences and learning about social protection responses to COVID-19, as well as discussing the future of social protection in a post-pandemic scenario or in a second phase of scenario. So registrations will be open soon. So coming back to our webinar today, just to give you an overview of what we will be doing in the next hours, I'll share some opening remarks on behalf of Karen. Then we will have a first presentation by Laurie Heiss, the Professor of Social Epidemiology and member of the Cash and Intimate Partner Violence Research Collaboration. Then we'll have another presentation by Melissa Alvarado from Ending Violence Against Women Program Manager from UN Women. And then a third presentation by Lorena Fuentes, co-founder and principal of Ladysmith. After that, I'll provide some short comments, maybe to bring together some of the key messages coming from the presentations and hopefully also helped to start some discussion. We will have, of course, a Q&A session at the end. We really encourage you as the audience to send our questions to the panel throughout the webinar through the Q&A Zoom function that you'll see at the bottom of your screen. It will be really helpful if you can clarify to whom you want the question to be addressed to, and we'll do our best to address the questions during the meeting. If not, as common practice, we will also send written answers afterwards. So let's get started. As we know, we are in an unprecedented moment. COVID-19 is a health pandemic, but that has created very critical socioeconomic impacts, but also has created a concerning shadow pandemic of gender-based violence. Most countries have seen disturbing increases in domestic violence. For example, data from earlier this summer indicate that helplines in Singapore and Cyprus have registered an increase in calls for more than 30%. In Argentina, emergency calls for domestic violent cases has increased by 25% since the lockdown. And in France, reports of domestic violence have increased by a similar 30%. Beyond intimate partner violence, other forms of violence are also in the increase, including sexual exploitation and abuse, including or especially against female healthcare workers, among others, harassment, as well as child early and forced marriage. The challenges with GBV are exacerbated since providers of medical, legal, psychological, and social services have also constrained access to survivors. I think we've seen, I think we've seen since the beginning of the response that social protection programs have emerged as a key pillar of the response, of the immediate response. Since March, we've seen an unprecedented expansion in coverage using existing systems. Virtually all countries have introduced new social protection measures in the response of the pandemic, either using their existing programs or creating new programs, covering an additional of 1 million people. We know that the evidence linking cash transfer programs to reductions in intimate partner violence is growing very quickly. I think what is particularly encouraging is that IPV reductions associated with cash transfers are often large, comparable to other non-cash IBP-specific interventions. Since cash transfer programs as an instrument of social protection are largely used to respond to poverty and economic vulnerability, we're not anticipating or suggesting that large-scale government programs be designed with the main objective of decreasing IPV. And I think this is very clear to stress at this point. However, if small changes in program design can decrease IPV, this will be a major win. And I think this is the moment for innovation and to really trying to see this moving forward. Cash transfer programs have substantial reach at relatively low cost, and leveraging their potential can help address IPV, which has intersectoral impacts without diverting scarce resources available for violence-specific programming. And I think, again, this is a great point to make. As our presenters will discuss, there is emerging evidence on the links between the reduction of IPV and cash transfers and the specific pathway through which cash may affect IPV. We still have yet to see systematic testing on what programs design could lead to the most significant impacts. And I think this will be important to discuss how to definitely sustain the impacts and make the best out of the results that we have seen and really apply in the best way the evidence that we're going to listen today. We need to better understand how different elements of program design, such as who received the transfer, the amount of the money distributed, how it's being transferred, the duration of the transfers, as well as how the program is framed and its objectives, including the inclusion of a specific add-on components that can affect outcomes. I think it's important to recognize that GBV and IPV, and I think in general, violence can be very difficult topics to broach. There is understandable reluctance to attempt to address it by practitioners who are not necessarily well versed in the complexities and risks associated with these types of interventions. And indeed, there are significant risks. Women may be put in danger from receiving cash due to men using violence as a method of taking the cash, or if men use IPV to reassert their authority after a shift in power dynamics. Women may also feel unsafe sharing information about their situation, so data collection must be conducted carefully and with a specific purpose in mind, rather just for data's sake. However, if managed carefully, there is a clear and specific opportunity that we may have here. This does not mean that we should not remain extremely cautious and meticulous in our attempts to more systematically understand the linkages and design programs that are more intentionally looking to decrease IPV violence. Depending on the specific features, programs must include, as a minimum and starting point, risk mitigation mechanisms, and then carefully monitor potential adverse effects. So maybe I would like to, we would like to wrap up this first introductory remarks, which I'm making, as I mentioned, on behalf of Karen, with an explicit call for a more systematic and intentional operational design with learning in mind. And I think this is a critical part of what we want to do today. Despite the significant challenges it poses, the increase in IPV during COVID, together with the unprecedented expansion in social protection, particularly cash transfers, present an opportunity for social protection practitioners and as well as GBV practitioners to go beyond a silo or safeguarding approach and look into how we can design better programming for violence prevention. So in considering how to best frame the research moving forward or the learning moving forward, we can also consider, for example, increasing the evidence base of program design and complementary action, enhancing the use of mixed methods evaluation, taking into account, of course, the very important regional and other context-specific factors, as well as looking at medium as well as long-term impacts. So now I'm very pleased to introduce to you our distinguished presenters. I think we'll have the bios and photos displayed. So first we will have Professor Lori Heiss, Professor of Social Epidemiology at the Johns Hopkins Bloomer School of Public Health. Next we will have Dr. Lorena Fuentes, co-founder and principal of Ladysmith. Ms. Melissa Alvarado, Program Manager on Violence Against Women and Girls from UN Women, and then lastly, myself. So without further ado, I think I'll give the floor to Lori to start her presentation. Thank you very much. Lori, I think you're on mute.
Yeah, I think you need to give me control to share my, here we go. Thank you. Okay. So thank you very much. As Natalia said, I'm a professor at Johns Hopkins, and I'm here actually on behalf of a consortium of researchers who are really trying to sort out, to the best of our ability, what we can and cannot say at this point of the impact of social protection and cash programs or cash assistance programs on different forms of violence against women and children. I was given the task to try to set the stage because I recognize that there's many different people coming to this conversation. And one of the things that, let's see if I can get this to move forward here. And so one of the things that we wanted to do was to review what's known already about cash assistance and violence against women, discuss a little bit about what we're learning through research about the pathways through which cash appears to affect IPV, and then to note examples of how cash assistance programs could be further leveraged to deal with this, to deal with COVID and the extreme situation that we're facing today. And what I wanted to do was just recognize that not all of us who are coming to the conversation are either experts in social protection or experts in violence against women, and that actually there's three communities that in order to achieve the goals that Natalia and Karen set out, we're really going to have to learn about each other's programming and reality so that we can work together in order to maximize the benefit for women and children. So right now, these three communities include the social protection world, of which many of you probably come from. For those in the violence world, though, who work on violence response or prevention, the social protection world is not something that we interact with very often. So for those who may be coming from violence, I mean, social protection is an umbrella term that's used to talk about a series of different kinds of efforts that oftentimes governments or programs put in place to try to create a social and economic floor to protect people in times of shock or to reduce poverty amongst the very poor. It includes a range of things, from social insurance policies like disability benefits to labor market policies. It also includes care-related work. So when you have a government school feeding program for poor children, that is a social protection program. And then it also includes social assistance, and that's where the cash assistance comes in. And I think one of the things that we need to do when we're thinking about social protection as it relates to violence and COVID is recognizing that there's a variety of different types of cash assistance programs. So some are built into these large governmental programs that include a whole variety of different schemes to protect people. And some are sort of one-off, shorter-term things to deal with emergencies or humanitarian emergencies where people are displaced from their home because of a flood or a conflict and need immediate access to cash for survival purposes. And the impacts that both of those two types of programs might be having on risk of different types of violence may be very different, because one is long-term and predictable. It's part of something that you know is your household, for example, might be receiving this benefit every month. And the other might be a short-term thing to get you over the hump in terms of a particular crisis. As Natalia pointed out, during this age and this era of COVID, there's been a real effort to try to mobilize existing and social protection schemes and put in place new ones, especially around cash assistance, in order to try to help households deal with this. And since about March, there's been about over 200 countries have actually changed and implemented new programs in order to try to boost the protection provided households during the COVID epidemic. So what we see in these new programs that are being implemented is that they tend to be of the short-term type, but they tend to be generous. So what I mean by that is that they are not part of, they tend to be short-term, but they tend to actually be up to maybe a third, 30% or more of per capita income. So they're actually supplying quite a bit of income to households during COVID. Now, the other community that's coming to this is people who are working on violence against women and their children. That includes a range of different types of violence, and those in the family, including intimate partner violence, child maltreatment, early marriage, so like child marriage, as well as kind of issues around sexual exploitation. Most of what I'm going to talk about today, though, is specific to intimate partner violence, because that is where we have the most information, and actually is where we think that we're probably having the biggest impact. It is the #1 cause of violence against women across the globe. It's also taking place in households who are now oftentimes have their mobility restricted and higher exposure and higher stress. So we're going to focus in my comments on intimate partner violence. And then the last community that is coming to this conversation is the wider women's economic empowerment community. And as you know, and you'll hear from Melissa, there's a lot of efforts being done both in the humanitarian and the development space in order to try to empower women through savings groups, access to credits or improvement in markets, access to financial services like mobile banking, as well as reform of discriminatory laws. It's in the area of cash assistance, though, that all three of these communities come together. So one of the things I wanted to share with you today is the results of a mixed method review that we did of all of the data that were available, both quantitative and qualitative studies, as of about 2 years ago. I also update this a little bit based on some new studies that have come through. But fundamentally, the findings of this overview still hold. And what we did in this overview is we tried to gather everything that we could about what had been known. And again, none of these programs were designed for the purposes of affecting intimate partner violence. So most of this research has been attempting to integrate, let's say, a measure of violence into an evaluation study in order to see whether or not it was having an impact, either positive or negative. And then there's also been a number of efforts to try to do qualitative studies, to go back and interview either concurrently or after the fact to try to understand how the addition of the cash influenced dynamics within the household. And as part of this review, one of the things that we did was not just look at the numbers in terms of did it have an effect, but really try to think about how might cash influence things like risk of intimate partner violence. And so what we developed was what's called a program theory, which is saying, what are we learning from these studies? And what do we know from other studies about the ways that cash may actually work to influence risk of violence? And then in the review, we also looked at some of the program design things that Natalia mentioned, and to try to identify research gaps. So are there things that we could be doing or doing better to improve the impact, either to reduce potential harm or actually to improve the benefits that cash infusions into households are having on risk of IPV? So this slide is a little busy, but what this is fundamentally the results of that review. And the take-home message from this is that there were 22 studies that were available in low and middle income countries when the review was done. There's now been both another overarching review and an additional 2 or 3 studies that have come out since this review. But fundamentally, what you see is that the vast majority of them show a decrease in overall risk of intimate partner violence. There were no studies that actually showed an increase of risk. There were a couple that were mixed, and there was a couple that showed no relationship that could be identified. So the take-home message here is that based on what we know today, most cash assistance programs seem to be having a positive impact at the level of maybe 7 to 15 percentage points reduction in overall IPV, even though they weren't being designed with that specific intent in mind. The other thing that we see is that most of the impact seems to be clearer with respect to physical and sexual violence than impacts on emotional violence or controlling behavior. So this is very promising, although as anyone who does this kind of research knows, all of these studies, have their limitations, and I think it's a strong indication that this can be a promising intervention, although we do need more research. So just looking at pathways, we identified 3 primary pathways through which cash appears to potentially be working to influence IPV. This includes one that operates at the household level, which we call economic security and emotional well-being, one that operates at the actual dynamic of the couple or the marital level, which is what we call inter-household conflict. And the third is specific to the woman, which is women's empowerment. And I'm going to go through each of those very briefly. So the first pathway that we hypothesize, and there seems to be some evidence for, is that by having cash, access to cash, especially among poor households, you have increased financial and food security, increased savings, and that actually that translates into higher emotional well-being. So you have improved mental health and decreased stress related to poverty. That in turn can directly influence the risk of intimate partner violence, or it also can reduce what we call kind of negative coping. So if someone would, for example, because of stress or mental health problems, turn to something like alcohol, if we can decrease alcohol, we could also have a positive impact on reducing IPV. The second pathway is one that is more specific to conflict between the couple. And here is by, again, having increased availability of cash, especially in very poor households, you see less conflict. And one of the things that comes through from the qualitative data is that in poor households, oftentimes what happens is that the woman needs to negotiate with the man on almost a daily basis for the money to go to the market and to get food for the day. And that interaction, especially if there is not enough money, or if the husband has spent it on something else, or just the stress around that discussion, can be a trigger for conflict in the relationship. And so the idea is that by having access to small amounts of money that allow the woman to actually meet her daily needs and avoiding the conflict over where's the money going to come from and trying to get it from the husband, that this might actually reduce the number of fights. And you see that in the quotes from this example from Turkey, where the woman says here, there've been many fights because the children needed many things that could not be afforded. I asked my husband and he used to say there is no money. Then I used to get upset and start to yell. We had many fights because of poverty, not only for us, for all poor people. Fights come from suffering. And then the final pathway is one which is frequently talked about, but can actually work in two different ways. And this is the notion of women actually being empowered and having enhanced kind of self-confidence and financial autonomy by having access to cash independently. The idea here is that by having more independent ability to either more independent access to cash and therefore able to manage her own affairs, that she would have either more power in the relationship, that this shifts the power between the man and the woman in the relationship, and that if it's a significant sum, that actually she would have more opportunity to leave. In our experience thus far in the research, the notion of women being able to leave has really not been so much of a credible threat because the amounts are not sufficient. But there does seem to be a shift in the power relationship that happens, and that whether it has a positive or negative impact on violence oftentimes depends on the partner's reaction. So if the partner is accepting and sees this as a positive thing, of the woman being able to bring more income into the family, then actually violence appears to go down. If the partner's reaction, though, is negative and he somehow feels threatened that the woman's access to independent cash is usurping his sort of gender traditional role as provider, it actually may increase conflict. So these are the three major pathways through which we believe cash may be affecting IPV, and that they may be not just one operating in any setting, but multiple overlapping pathways. Just very, very briefly, in terms of additional information, there has been a review on the impact of violence on children and adolescents. And here we see some promising results about the ability of cash to households and to girls in terms of reducing the risk of sexual exploitation or multiple partners, mostly through the pathway of reducing the need or the need for young girls to have sex with older men or different men in order to get access to resources. There's many research gaps though here, and so I think this is an area that needs a lot more attention. And if you look at this research base, it's the mechanisms that are play are even more diverse than the 3 pathways that we laid out here. So this is an area I just wanted to flag for people that there's some promising evidence, but it's one that we need to do a bit more work on. And finally, just a few thoughts about how we could multiply the positive impacts of cash with respect to women's risks during the period of COVID. And I think here, my main message would be that we have to act in the short term, but we have to think in the medium and long term. So when we're designing or we're engaging with programs that are dealing with emergency transfers to address COVID disruptions, I think we need to strengthen both investments at a governmental and other level in response services to violence and to victims of violence, especially now remote counseling and support for women and children during lockdown. And there has been an effort to increase helplines and to help make those and advertise their availability. We also should be negotiating with governments to make all gender-based violence services essential, in the sense that these should be some of the things that are maintained even in periods where mobility is restricted. And we need to do a much better job at advertising the availability so that people actually do know where they can go. And finally, I think we need to ensure that social protection teams have at least a minimal understanding of the dynamics of violence, of the services that are available, and where appropriate can be trained on things like child safeguarding, ethical referral, and even psychological first aid, which is a very simple intervention to help people deal with crisis. And when we're looking at the social protection long term, I think we should be thinking about what we can do in cash plus programs. So the add-on ancillary programs that could actually help forestall the kind of backlash we sometimes see from men. And I think there's a lot that we can do here with media and with parallel programming. I think we should consider relaxing and removing some of the conditionalities that are currently attached to some of the aids, which can exacerbate women's care and domestic responsibilities, especially in areas where mobility is restricted. And I think we should use every opportunity to reinforce positive framings around the purpose and benefits of the transfers. One of the things that we're seeing is cash is not just cash. Cash is the meaning that is attached to the cash. And so depending on how it's framed, is it framed as cash to households to help young children? Is it framed as cash for women's economic empowerment? Is it framed as cash for an emergency or cash for long term? All of those framings really influence how the cash actually enters and affects household dynamics. So I'm going to stop there and turn it back to Melissa. Turn it over to Melissa, I guess.
Sorry, my Zoom froze. Thank you so much, Lori, for this very exciting set of slides and the very exciting evidence that hopefully we'll have time to discuss during the Q&A. I would like now to give the floor to Melissa Alvarado, who will outline the impact of COVID-19 on GBV and talk a little bit about the VOW program in the Indo-Pacific region. Melissa, you have 12 minutes. Over to you.
Thank you so much, Natalia, and to all the organizers of this session. It's such an honor to be with you today. I've just been asked, and I think I can. So let me give that a try. All right. Do you see my screen okay?
Yes, we see it very well. Thank you.
Okay, good. Okay. So it's a pleasure to have a chance to be part of this conversation, because as a practitioner who's been focusing on ending violence against women for so many years, I have steadily become more and more interested in what happens when we're also paying attention to women's economic empowerment and all of the issues that COVID has raised in the past several months have really come forward and forced us to ask new questions about what's the role of women's economic empowerment, social protection, and how can we reach women better at scale? How can we prevent violence better, even during crises like this? So I'm going to talk through some of those connections today. So what I'll cover in this session, and I'm just going to be rather high level and brief and try to show some of the connections that we're paying attention to. So we're going to look quickly at violence against women during COVID, the linkages between women's economic empowerment and status and violence against women, social protection, including and beyond caste-based initiatives. And then I just wanted to make a quick note that in my presentation, I'm primarily going to use language related to violence against women, but you will see language on gender-based violence, which for us is defined as a form of violence against women. And recognizing that that's typically used in a humanitarian and emergency settings. So what we've seen unfold during COVID is something that many are calling a shadow pandemic, including us. But for those who've been working on violence against women for many years, including in emergency settings, we were not surprised. In fact, we felt like this was something that was perhaps hiding in plain sight. And many of us, in fact, anticipated that we would be seeing serious increases in violence against women related to COVID and all of the tensions and anxieties and fears that have come alongside it. And so, we have a very solid evidence base that we're standing on, that we are now utilizing. And I think COVID has been a really important reminder that we already have really solid evidence to stand on. We want to use that. We want to move forward. And I say that because there's been a lot of questions about should we be collecting new data, and we're really advising people, actually, we have the data we need. And I think maybe Lorena will speak to that a bit as well. But we have seen really important increases, notable increases, calls to hotlines, shelters, crisis services, that is signaling to us that there's a big problem out there related to violence, and there's important unmet need. We also know that many women actually never report to the violence that happens to them. And so those women who do report are really just a drop in the ocean in some respects. And so as Lori said, we know that we really need to be investing more in prevention and keeping violence integrated into our COVID response plans and prevention plans. Now, as we think about this, the dynamics that are unfolding in front of us related to the economic fallout and violence against women really surging in so many places, we're really reminded that women's long-term economic security, autonomy, and power in an intimate relationship are key factors in preventing. Lori has already talked about. We also are aware that some economists speak to the credible threat of leaving abuse. For a woman to have, say, income, a job, savings that will allow her to escape a violent situation is incredible, to have that behind you and to know that you can actually walk out the door when you cannot walk out the door because you have no resources with you is terrifying. And so we've seen that in places like in Bangladesh, we've seen research that says that women with higher educational attainment and who are engaged in paid work are less likely to experience violence, and that globally countries with a higher share of women in formal employment have lower levels of intimate partner violence overall. So we're conscious that there's really an interplay here. And I thought this would be a good moment to share what we're calling the RESPECT framework. This is a rather new framework that has recently been released. It was developed by the World Health Organization with UN Women, and a number of other UN agencies and governments have signed on to it as well. It really profiles what are the leading approaches that we believe will allow us to be more successful in preventing violence against women and girls and have already evidence behind them. And so here we see highlighted a couple areas that are connected to economic empowerment as well as poverty reduction, and within that cash transfers. So I wanted to just share that these really critical linkages are emerging globally. There's a fairly solid evidence base behind them, and I thought that would help us frame this conversation around cash and so well. So Lori has already talked a bit about some of the evidence coming from lower and middle income countries. Here we see from the RESPECT framework a bit more information about what's the evidence telling us now related to what's promising, or where we need more evidence, what we believe to be perhaps ineffective approaches to prevent violence against women and girls. So I'm just going to take a moment and highlight some of these. So in the promising group, you can see that there's group-based workshops with women and men. That's an important note that, it's both. Empowerment training for women or girls has been shown to be useful and effective. Here we see inheritance and asset ownership policies and interventions, social and economic empowerment combined together, and then economic transfers, as we've just spoken about, related to, say, cash or food or other types of supports, parenting interventions, community mobilizations. There's a whole range of interventions that we've been testing over time in all parts of the world, and we're finally starting to see some very solid evidence emerging around what's working and what's not. I think what's also interesting about this list is paying attention to what's at the bottom of the list, the ineffective interventions. I think we want to pay attention to those too. So that's been demonstrated to be microfinance or savings interventions without the additional components that might support gender equality, bringing people together to talk about power, decision-making, how we're sharing the load, sharing the power in relationships, group workshops with men only, and then standalone awareness raising. So I'm not going to walk through all of it. I would really encourage those who are interested to locate the RESPECT framework and take a look, because there's explanations for all of these approaches within that. Now, just to kind of come in a bit more on the women's empowerment programming and the linkages with violence against women and what we're still learning, we want to note that social empowerment only training for women and girls, such as life skills, safe spaces, and mentoring, has shown promise in many settings to prevent violence and reduce violence. Again, we see promise related to cash and food transfers to households. However, we note that other economic interventions only, for example, microfinance, savings and loans, not looking to be effective by themselves, and it can also increase backlash to women. So again, when we're seeing perhaps a shifting or rebalancing of power and influence in relationships and families, we can see backlash, and we want to mitigate that. We actually want to expect that, anticipate that, and find ways to mitigate that right from the start. And we note that combined social and economic empowerment interventions for women and girls seem to be effective in reducing violence. So this is when we can bring together those social empowerment skills. We're talking directly about gender equality. We're talking about healthy relationships. We're talking about, sexual and reproductive health and rights often, as well as women economic empowerment, such as microfinance, savings and loans. And we also have appreciated over time and through many different approaches that have been evaluated and researched, that it seems like when we're most effective when men and boys are also engaged. So either that might be because they're supporting women's empowerment programming by reducing backlash, or because they also participate in activities to improve household livelihoods. We don't want to see programs that are giving cash or jobs to women, and then there's men at home who are not supporting them and letting them do all of the work, all of the childcare, all of the unpaid care. So we want to pay attention to that too. Now, in this next slide on social protection and violence, and we're very aware, as Lori has highlighted from the start, that social protection really does go beyond cash transfers. And we recognize that for women who are in crisis related to violence, there's been violence in the home, maybe they feel their lives are in danger, or they might be seriously harmed. When they have access to crisis support, this can prevent harm, injury, disability, homelessness, even death, of course. Violence against women is a fatal problem. And then we also recognize that when services for violence against women survivors are seen as essential, this is really helpful to connect with other social protection schemes, and including right now during COVID, and in those budgets that are being outlined for response and prevention. So we can find some really powerful connections here. We also know that a lot of social protection actors are very keen to take a coordinated and multi-sectoral approach, and that really aligns well with how we want to see violence against women's services formulated ideally. There should be a very strong multi-sectoral approach that brings together health, social welfare and social services, police, justice, shelters, etc. And so linking in those social protection programs often happens, but not always. And we recognize that that's a really important value we want to bring consistently. We're also aware that when we're looking at poverty-only focused social protection plans, that we may miss many women who face violence against women and who maybe until the crisis event were not considered in poverty, but might be suddenly, unexpectedly left without resources, without money, without income, perhaps even without home or clothing or food. So this can create a really intense sudden shock. And when we have the ability to make sure the social nets are available to them, this can prevent longer term damage and harm, as Lori was also discussing. We've created a global tool related to what's considered essential when women and children are experiencing violence. Here we're focusing on women and girls. And what we have acknowledged is that material and financial aid is one of those critical components that can let people recover with dignity in the short term and in the long term. So I think I have about 2 more slides. I wanted to just quickly share that these linkages that we're acknowledging, we're really kind of paying attention to them more and having more discussions cross-sector. So that we recognize that cash transfers have a value beyond humanitarian and social protection needs, that they can link in with important policies on economic development, employment, bringing women more clearly and centrally into those plans, and that they fit quite well often along the humanitarian development nexus. I think we've already spoken to the benefit of cash transfers related to GBV, and that also it's really important to bring in that cash plus programming, which can help us address those issues of gender inequality. We have seen really important value in partnering with women's organizations, local women's organizations. If, for example, we were planning a cash transfer, they could help us identify and predict risks and manage those risks ahead of time. And then just broader, we want to acknowledge that partnering with national governments to link the cash transfers agenda to employment generation, income opportunities for crisis-affected women, including young women, is something that's coming. I'm going to close with these final recommendations. A little bit, I feel like Lori's already said, but just the importance and the value of including violence against women during the design stage of cash and social protection interventions, involving violence against women specialists as we are designing those interventions and as they're being planned, implemented, and evaluated. And that's a bit distinct from a gender specialist. And finally, the important value and power we see of bringing in a complementary programming together. So I'm going to stop there, and thank you so much for your attention.
Many thanks, Melissa, for your presentation and very interesting insights. As we're a little bit late, I'll just quickly give the floor to Lorena Fuentes, who will share her research on the impact on COVID on GBV, income insecurity, and social protection needs for women on the Colombian-Venezuelan border. Over to you, Lorena.
Thank you. Just going to share my screen. Can everyone see that?
Yes.
Great. So yeah, good morning, everybody, or good afternoon in the evening, wherever you are in the world. As was noted, my name is Lorena Fuentes from Ladysmith. I do want to say that I work alongside a team of brilliant researchers with deep expertise in gender-based violence and social protection. So we're really grateful to the conveners for inviting me on behalf of Ladysmith to this knowledge sharing opportunity today. So the evidence emerging on COVID-19 and the public health response globally shows concerning impacts for women and their experiences with, the so-called shadow pandemic of gender-based violence or violence against women. But as Melissa rightly noted, I think it's really important to highlight that COVID-19 has not created the dire situation that we're seeing for women. It has exposed and magnified the consequences of inadequate gender-based violence services and, frankly, quite patchy social protection systems. And this is particularly true in humanitarian contexts, like the one I'm going to be speaking about today. So I'm going to use the next 12 minutes to present a rapid analysis of preliminary data that Ladysmith has collected at the Colombia-Venezuela border since the onset of the pandemic through our gender-responsive digital intervention, Cosas de Mujeres, which is the first implementation of our broader project, Gender Data Kit, which I'll be talking about shortly. And drawing upon this data, I'll provide some nascent reflections on how, in the context of what is a humanitarian and global health crisis, gender-based violence and social protection information and services might be better coordinated so that we can strengthen the safety net for some of the most vulnerable women. So very briefly, what is Gender Data Kit? It's basically a set of gender-responsive technologies, feminist methods, and resources that we use at Ladysmith to close gender data gaps. So this is not data collection for the sake of data collection. As Melissa noted, this is both unneeded and problematic in the context of violence against women. This is data collection in order to mobilize resources and political will and ultimately catalyze action. So it has three overarching components that inform the design of specific interventions. First, we use widely available digital tools to help us collect data to identify, measure, and track patterns of gender inequality. Second, Gender Data Kit enables the collection and use of both qualitative and quantitative data in order to bring women's voices to the forefront of evidence generation. And finally, we use principles from feminist research to guide all of our data management, our data interpretation, and ultimately our data use. Our first implementation of Gender Data Kit is Cosas de Mujeres, an intervention at the Colombia-Venezuela border in the city of Cucuta. There, we're using WhatsApp to collect data on gender-based violence experienced by Venezuelan and Colombian women during migration journeys and once they're resettled in host communities. And what we're doing is we're feeding this analysis back to the organizations that serve these women. And so this includes gender-based violence services, but also those related to health, food, cash, or employment, for example. So that sort of compendium of social protection components that has already been discussed by Lori and Melissa. So why did we embark on this project? Well, in the midst of the largest migration in recent history and a reconfiguring armed conflict, gender-based violence was already a sort of hidden epidemic in Cucuta on the Colombia-Venezuela border. And the problem is really twofold. First, women lack information about where they can go for help. And then policymakers and service providers lack accurate and useful data, which is part of what impedes an effective response. The way that it works is as follows. So Cosas de Mujeres builds bridges between women and the services that already exist. So when a woman sends a message to Cosas de Mujeres, she receives a response from a member of our team. We then provide her with contact information for gender-based violence and related services. All of these services have been verified by our team through a ground truthing process with the organizations themselves, and crucially, in collaboration with local grassroots feminist groups. And so what that allows is for us to have a high level of confidence that if we send a woman to a service, she'll actually be attended, and she'll be attended in a gender-sensitive way. And it's through this interaction that Cosas de Mujeres generates useful data about gender-based violence on the border and feeds this back to the service providers, to grassroots feminist women's groups, and ultimately development partners too. Now, I want to provide an overview of the sort of pre-COVID situation in Cucuta and our findings from our 2-month pilot, which was between January and February of this year. So during this period, we exchanged more than 2,500 messages with Venezolana and Colombiana women requesting information and seeking support around gender-based violence and other related vulnerabilities. Now, and this is particularly important to our discussion today, we found that the majority of requests for gender-based violence information overlapped with requests for elements of social protection. And for example, this would include food vouchers, cash transfers, employment opportunities, and vaccines and other health-related services for children. And here it's really important to underscore that the before COVID picture of social protection and gender-based violence services for the women that we engage with through Cosas de Mujeres wasn't great. So to put it bluntly, the needs far outweighed availability and accessibility. So first, migrant women from Venezuela do not necessarily have the same access to social protection as Colombian women, which might be expected. So for a Venezuelan migrant, access can depend on whether or not her passport was officially stamped when she crossed the border into Colombia. And honestly, it can depend on the luck of who she encounters. So what humanitarian organization she encounters once she crosses the border. And even where access to social protection is permitted for both of these groups of women, figuring out how to navigate registration can be really, really difficult. Colombian women are, of course, more likely to be integrated into existing social protection systems of contributory and non-contributory benefits. But even then, access to the full range of needed benefits and services can be complicated and often unclear. And this has been compounded in the context of the health crisis. So information gaps are rampant around what social protection services exist and how and when women can access them. We found that the gaps not only exist amongst women themselves, but crucially amongst frontline service providers and other gatekeepers. And that's in part because the requirements change quickly and often without notice, and registration documents between the two countries are often incompatible. And of course, in the context of a humanitarian crisis, many of the forms of aid that we're discussing today, including cash programming, are operated by humanitarian groups who work on their own schedules and with their own needs assessments in terms of who can and cannot register and why. These services are often also located far from the lower income communities where migrants are actually settling in Cucuta. So this is all to say that navigating access to social protection before COVID hit was already a tremendous challenge, and the pandemic has compounded this significantly. So within days of the World Health Organization declaring a global pandemic on March 11th, 3 policy choices were made in quick succession in Colombia. First, on March 14th, the Colombian government shut down the border with Venezuela. Secondly, it requested that international organizations in Cucuta have their service offering. And it was not only those services directly related to gender-based violence, such as shelters, which were deemed quote unquote non-essential, other services that are critical for women's empowerment and thus to their capacity to potentially leave a violent situation or reject one from the outset were also cut. So that means soup kitchens, centers for medical attention, and migration support services. In the midst of these changes, the majority of the existing gender-based violences shifted to online or telephone models of service delivery. Shortly thereafter, on March 24th, the country entered into a lockdown, which stipulated that people stay inside their homes with the exception of buying groceries or medicines. Now, it is important to note here that the Colombian government did make some cash transfer programs unconditional during COVID. However, here again, I have to sort of remind people that the border city of Cucuta, where we operate, has a high level of transience, and the women that we engage with are in especially precarious situations without fixed addresses, and thus are largely just not integrated into these programs. So these are women whose vulnerability is so acute that they are more likely to fall through the cracks of existing services and webs of social protection. So starting the same week that the country entered into a lockdown, our team bore a witness to a real shift in the nature of messages sent to Cosas de Mujeres. At the extreme end, we received messages from women who were now quarantined with abusive partners or in overcrowded housing. They reached out requesting legal and psychological support, as well as urgently needed medical attention for injuries. Women disclosed that they were enduring violent situations with partners or former partners because they did not have the resources to leave. Women also reported having difficulty accessing help through all of this sort of explosion of advertised hotlines, citing things like unanswered messages. They reported difficulty accessing in-person services that remained open due to changing service offering and fluctuating hours of attention. The grassroots women's organizations that we collaborate with reported that there is no support for women who seek attention in the evenings, overnight, on weekends, all of which are times where violence, of course, can still and does still occur. And at the other end, women sent messages expressing real distress about the social and economic well-being of their dependents now that they had lost their sources of income and support services that, in the past maybe closed some of those income gaps. They all seemed to be closing around them. Because of the quarantine, some women who were earning a daily wage lost these income sources, leaving them once again in highly precarious situations without the ability to pay rent or buy food or medicine. And a big bulk of the women that wrote to us during this period were at risk or already sleeping rough, as we call street homelessness. And finally, a lot of Venezuelan women wrote to us saying that they were outright refused attention by public services. I think for today's purposes, the most interesting finding has been that nearly 3/4 of the women who wrote to Cosas de Mujeres in this period between March and August 31st, Cosas de Mujeres is advertised as a gender-based violence service information platform. But nearly 3/4 of the women who wrote to us also asked for socioeconomic forms of support for themselves, for their children, and or for dependent older family members. So the messages that we've received from women evidenced that these dynamics, so loss of income and socioeconomic support, threats of eviction and subsequent rough sleeping, were all being experienced in quick succession and were compounding pre-existing risks to gender-based violence. So these are, of course, preliminary findings, but I think they shed or lend themselves to some of the existing evidence base on the need for gender-based violence and social protection providers to work together to ensure better coordination. As the situation currently stands, the lack of consolidated information and referral pathways between the two is compounding an already very precarious situation for women in the border city of Cucuta. Things change often, services shut down and come back up, and navigating the waves of misinformation has become very confusing and daunting for women. And here, as a team at Ladysmith, we always reflect on findings such as this and think, if we, through a team of researchers and practitioners that have the time and resources to dedicate to mapping, services and referral pathways, if we are not clear on what the rules look like and can't clearly identify how things work, how do we expect women in highly fraught and precarious situations to do so? So Cosas de Mujeres has sought to really consolidate bridges between women and gender-based violence and related social protection services. But I think one thing that we're also doing that's quite important to highlight here is that we're trying to consolidate a network consisting of quality gender-sensitive service providers across gender-based violence and social protection sectors. So two fields that, as Lori mentioned today, are often operating in silos. And we're also connecting these official service providers to groups of really extraordinary local feminist organizations. And this is all in the interests of connecting Venezolana and Colombiana women to a broader, but also less porous web of support. So I'm gonna end with a few recommendations. So how can we ensure that vulnerable women in contexts such as the one I've elaborated above are able to access the available elements of social protection, which can also serve as important preventative mechanisms against gender-based violence? First, women's access to services needs to be streamlined. Coordination and communication between service providers and state institutions is key. This will require that different sectors, including GBV, health, social protection, and more, work together to streamline women's integration into the existing web of support services that can help them to avoid or exit violent situations. Second, staffing and resources for hotlines and other online services designed for the COVID context should be bolstered. So those resources need to be increased because too many women are being left without a response. Third, funding should be provided directly to grassroots feminist organizations who continue to fill service gaps during the pandemic. These same groups need to be meaningfully integrated into the planning meetings and policy decision-making about how to build back better, as we've been saying, in the aftermath of COVID. And finally, you know, at Ladysmith, we feel very strongly that we need to increase access to unconditioned socioeconomic resources, regardless of migration status, and including once quarantine restrictions are lifted. And I'm gonna end there, but I'll of course be really happy to answer additional questions during the Q&A.
Many thanks for this very interesting presentation, Lorena, to give us some examples also from border situations, which of course are also the top of the agenda. This has been a fascinating session and set of presentations. I just want to maybe try to highlight some common threads that I've been hearing from the different presenters, and then hopefully pose some questions that will help to move the discussion as we move forward. So I think that as discussed in the beginning, COVID has not only highlighted the importance of particular programs or policies such as social protection, but that there's also many of the socioeconomic dynamics that have been created by COVID has also critical impacts on other sectors, mainly violence, including gender-based violence. Social protection has been a critical pillar of the immediate response, but it will be important that it's also part of a longer term strategy, even thinking about an inclusive recovery strategy. And this is, I think, an opportunity to make sure that as we move forward, we can integrate elements and address some of the gaps that COVID has also highlighted or magnified. And I see a couple of elements that have been raised. One, that even though the response was effective and was immediate, and it's definitely commendable the efforts that many governments have made in terms of using and scaling up their social protection programs for immediate response, we still know that there is a lot of gaps in terms of coverage of flagship social protection programs in terms of children, in terms of elderly people, women, etc. Also gaps in terms of the adequacy of programs, including for those in the informal sector and also in the care economy, which continues to be, as we know, an undervalued sector in many regions. The highlighted once again the importance of the differentiated impacts between women and men in terms of these types of crises, and therefore the need to have specific tailored approaches to be able to address different vulnerabilities and different ways of coping with crises. And I think, as many, if all of us have been highlighting, making even more visible the other pandemic or parallel pandemic, more than shadow, but parallel pandemic that is happening in terms of violence, gender-based violence, as well as violence against children, which is something that we should also maybe talk a little bit more during the Q&A. I think that one point that, thanks to Lori's presentation and the work of many researchers across years, is that we have a clear sense, if we want, around evidence. Cash transfer programs do have a role to play in preventing and reducing GBV, including IPV, and some forms of violence against children. However, we also know that unfortunately the evidence sometimes is little known or often inaccurately reported. So I think these types of webinars and spaces are key to be able to socialize and continue to discuss the evidence among different communities, not just among ourselves, not just only among the social protection or amongst the women's economic empowerment groups or the GBV group, but as a community of integrated actors that are really trying to understand better the linkages and the dynamics in terms of understanding causes, but also better responses. we also know that the evidence is nuanced, and I think that is also important when we are communicating these types of evidence to policymakers and using these types of evidence to influence the design of policy and programs. And that, as many of you have adequately said, there are also some gaps that we need to look in terms of research and continue to dig in further. I think a lot of the evidence is very strong or well documented in terms of cash, but not necessarily on other social protection instruments or components of the system that could also, provide other hints or pathways around prevention. And I'm thinking about broader programs such as health insurance, labor type interventions, and others that sometimes we're not always looking at. And of course, it's sometimes difficult just to look at evidence around that. The second big point, and again, all of the panelists have been very keen in stressing this, is around the importance of reminding ourselves that we're talking about a multi-sectoral issue that requires, therefore, an integrated programming approach. Both poverty and exclusion, as well as violence, are multi-sectoral issues that require integrated programming. Not one element, not one strategy will be enough to address the multiple determinants of the particular issues, and therefore the different pathways and linkages that need to be addressed. And I think in this, with this recognition, it will be good to discuss, therefore, what is our level of ambition as we move forward. We know, and I think we all agree, that risk mitigation is a minimum starting point, but what comes next? I think Karen's points at the beginning was clear that we're not looking to have large-scale social protection programs that have GBV prevention of its objective, because that's not necessarily the main focus of social protection, but how can we better address, if you want, the better design and better implementation to, on a minimum, reduce and hopefully eliminate some of these issues. And I think there is where the challenge comes. What are the best mix of intervention? What are the different tweaks in terms of design and implementation that need to be addressed? And I think some of the examples that have been provided by the panelists give us some light around that. And the third big point is around how do we prevent working in silos, and the fact that we are here as a community of different sectors talking together and discussing these issues together is a critical first step. But also how to reflect that when governments are working together and trying to define the best program. And I'm specifically addressing one of the comments made by, I think it was Tia, in the questions around, social protection sometimes is focused in one particular ministry sector, GBV in another, women's economic empowerment in another, and they're not necessarily talking to each other or not necessarily looking at the issue as an integrated approach. And this is where I think the focus on systems and changing a little bit how we see social protection, not just as one sector looking at one particular instrument, but creating the incentives such as education, health, gender ministries, youth ministries, see also themselves as part of and main contributors of the social protection system, bringing different dimensions into the mix. But that is not it's easier said than done. No? So what are the specific incentives at sectoral level to be able to really work together in an integrated way? I think from UNICEF's perspective, we see COVID as definitely a challenge, but also as an opportunity to take advantage of the importance that social protection has been given. The scale of the work that we and other partners are doing in helping governments to really scale up their programs, and using that opportunity to also, as we move forward, to bring closer critical linkages with sectors that can help us to sustain the gains of cash transfer programs, but also to see different impacts across outcomes, including prevention and violence. The risk mitigation angle is a minimum starting point and is not a negotiable element, but it's definitely not the end of the story. So we are definitely committed as UNICEF to make sure that risk is effectively mitigated, including our role in the Interagency Standing Committee of GBV guidelines in humanitarian settings, applying similar guidance in humanitarian transfers. But I think it's also an effort to move forward and trying to also understand how do we better define complementary package of interventions to link with broader social protection programs and see a stronger change in terms of prevention of violence. And there's some work already being done, for example, to be responsive to girls and women's needs, and enhancing, if you want, response to women and girls affected by GBV through social protection responses in the context of the COVID response, such as work that is being done, for example, in Sierra Leone and other countries. And I think a big part of the work that we've been, I think, doing is trying to broaden the community of discussion around social protection and GBV to bring together different actors, such as in this particular webinar, so we can learn from each other, understand also our differences and different biases, and bring together a much more frank and integrated approach to address a common concern. So I'll stop here because I think there's a lot of questions and a lot of room for discussion. And I thank you very much, all the attendants and participants, for the great questions that have been posed. So I'll start maybe a first round of questions. I'll provide some questions for the three panelists, and please feel free to address them as you see fit. So Lori, there were a couple of questions focusing on the differentiated impacts in the evidence that you presented. So is there any emerging evidence on how cash and IPV dynamics change based on, for example, age or disability, example, versus young girls versus adult women? Another question also for you, Lori, that some evidence seemed to suggest that GBV is not necessarily associated with wealth. So interesting to see that cash can actually reduce the prevalence of IPV. So how would you explain this apparent contradiction? For Lorena, a question on, given the work that you and the organization is doing, how do we consider migrant women who experience GBV during this COVID period, and how we effectively integrate them into social protection responses at the country level? And Melissa, question for you. What about interventions to reduce GBV and promote livelihoods options for women? And there's particular interest in working in coastal communities, and if you can share any examples that you can think in that regard. So I'll stop here as a first round on questions, and then we can go to the second if we have some time. So maybe we can start with Lori.
Sure. With respect to the issue around differentiated impacts based on age or disability, I think the actual response is that we just don't have the research available at that finely grained level yet. I do think that it's likely to be different, and if we think about how cash may operate in different settings, I suspect that there are going to be those variations, but we really just don't have clear insights at this point. With respect to wealth, I do think the questioner mentioned the DHS data, the demographic and health data, and what we see there is what the data there are kind of a crude measure of wealth. So while there's not like a linear relationship between wealth and risk of IPV in households, there very much is a consistent relationship of poverty and very poor households to risk of IPV. So when you think about cash transfers and social protection, that's exactly the populations that you're usually working with. So I actually don't think that there's an inconsistency there.
Thanks so much, Lori. Lorena, would you like to go next?
Yeah, so for the first question, I think certainly our position at Ladysmith is that social protection should not discriminate based on nationality. what I was sort of getting at in the presentation with respect to the need for coordination and communication between these two often siloed fields of services and practice is one of the kind of more short-term ways I think that we see would address women falling through the gaps of the sparse, yes, but still existing webs of social protection that exist in this humanitarian context. So often with the women that we engage with on our platform, it's not necessarily that they're entitled to nothing, although it's not much, especially for Venezolanas, but it's that they have been missed and that they have slipped through the cracks. And of course there are issues with registration and documentation and, but we wouldn't have sort of launched this information platform if there was nothing to connect women to. And so, I think again, if there was better coordination between these two fields, that could allow for, maybe more concrete referral pathways, ensuring that, accompaniment in cases of GBV gets tethered to what forms of social protection does this woman have access to. I mean, I worked as a practitioner for 5 years in the United Kingdom on domestic violence and sexual violence. And, at the time there was a really kind of integrative referral pathway that like kind of forked out so that you had mental health services, health, employment, housing kind of working together. This is no longer the case, but at the time that was the sort of approach. And so I think sort of two main points again, social protection pie in the sky vision is that it should not discriminate based on nationality. And secondly, I think a kind of quick fix is to really prioritize coordination between existing services in both sectors.
Many thanks, Lorena. Melissa?
Thanks. So I'm responding to a question about interventions to reduce GBV and promote livelihood options for women. And I think, here I wanted to just kind of reflect back on some of what I was earlier presenting on. We've seen really promising approaches that are intentionally blending a sort of women's economic empowerment approach with an approach that's explicitly designed to address violence that we know can hold women back from actually enjoying the benefits of, economic empowerment resources, training, tools, credit, whatever it is that they're having access to. By addressing some of those power differentials and expectations, whether it's social, cultural, familial, in that relationship. And so if we're able to understand that happens, recognize that, prepare for that, design these programs with that understanding that is something that does hold women back, and it's a reality in their lives. And we've been able to see good progress, both on the indicators related to the economic empowerment and related to reducing violence and intimate partner violence. So I think there's some very notable approaches, and there's been a number of them that we want to come back to. After I speak, I will put a link into the chat for that respect framework, which nicely captures, a series of those interventions which you may want to look at also. And then, someone mentioned also coastal communities. I think that, I guess it depends on if you're talking rural or urban, but in many communities, especially rural communities, there are a lot of social norms about women's role in employment and in the home, and there may be some gender differences that don't allow women to participate in livelihoods or in the same, sort of selection of livelihoods that might be available to communities, and maybe not take full advantage of their assets and abilities and skills. And so by addressing some of those issues, we can perhaps make better use of women and what they have to bring, all of their creativity and assets, by addressing issues that are really about what we do at home. Who takes care of the kids, who cooks dinner, who does the laundry. So those things are really related to both women's economic empowerment, livelihood, as well as violence. So it's important if we're talking about those things together. Thanks.
Thank you so much. We have a couple of minutes left, so I'll maybe ask one more question that came many times in the chat. Lori, there are questions about why savings may be considered ineffective. If they increase a credible threat of leaving, why doesn't it reduce violence? And if you can expand on that particular point.
Sure. So I think when we're looking at all of these women empowerment programs, whether it's savings or microfinance, we should, one, recognize that they have very positive impacts, or can have, on women's economic standing that may be different from whether they reduce violence. And when you think about savings, I mean, you have to actually have quite a bit of money set aside in order to actually be able to leave with your children, and economically provide on your own. And the reality is that it's not just the money, it's all of the things that go along with, you know, is it okay to be a single woman? Do you have the legal right to take your children with you? I mean, in some places, if you leave, your children are, you go with your husband's family. I mean, it's all of those cultural and legal other barriers. So while a small amount of money at the margin is helpful in day-to-day, it's usually not enough to actually shift the power enough to compensate for all the other barriers that women face. So savings it's useful and it's good, but it's one strategy that needs to be addressed, along with a whole bunch of other things, before you really get into a situation where, as the economists like to say, I don't particularly like this language, but, you know, a credible threat to leave. Well, a lot of things have to align in your life. I mean, if you think about how difficult it is for even wealthy women in high income settings to leave, it's not surprising to me that some small amount of savings in the Village Savings and Loan Group is not going to be adequate to really shift that balance for women.
Many thanks, Lori. And I've seen we've reached the 10:30 mark. It's unfortunate because there's so many interesting questions coming our way. Just for the audience to know that if we were not able to address directly your questions, we will be preparing a written document where the panelists can share their perspective and responses to the outstanding questions. This is definitely, I would see it as one of the first discussions where we have different sectors discussing together, and the opportunity to continue to have this interaction as we move forward. I think it's definitely, we're definitely in agreement that this is a complex issue, that we do have to look at the real risks that exist, but also on the opportunity that the evidence is showing on the very important role that social protection, in this particular case, cash transfers, can play. That we're talking about a multi-sectoral approach, and we're talking about integrating programming, and that has its own challenges on its own. I do think that maybe we didn't discuss such much on how to effectively convey this evidence to our policymakers to be able to use it in an effective way, and I think that's still something that we need to constantly think about. What is the best timing of the evidence? How do we partner, and how we also continue to develop evidence that it's particularly addressing the very critical policy concerns that are at the core of many of our government partners. With this, I would like to thank very much on behalf of myself and also Karen, that was the original chair, all the wonderful panelists that participated, the very active audience, and of course socialprotection.org for providing us the platform to have this very critical discussion. Looking forward to continue working collectively to further this agenda. Thank you very much.